So you respond to the base BX for a 23-year-old male experiencing dyspnea.
Alright, BSI is my student safe.
Yes.
Number of patients is 1. My nature of illness is dyspnea. I'll have ALS on standby. I will consider C-spine stabilization but not take it at this time. What do I see, smell, or hear? I see a patient struggling to breathe sitting in the tripod position. My general impression of my patient is poor. Hey sir, I'm Sergeant Hatch from Metsi EMS. This is my partner, Sergeant Harvey. Can we help you?
Yes, please help me.
Alright, are you okay? My partner goes ahead and starts some vital signs. They're going to be looking for your blood pressure, pulse, respirations. They're going to make sure that your eyes, that your pupils are equal, round, reactive to light. Your skin, color, condition, temperature, SpO2, and a blood glucose level.
Yes.
Sounds great. Can you tell me your name?
Sergeant Burnside.
Can you tell me what time it is?
It is 10:07.
Can you tell me what's going on?
I was eating lunch and started having difficulty breathing.
And can you tell me where we are?
We are at Metsi Mid-4.
My patient is ANO times 4. They are, and then can you tell me why you called?
I was just finishing my lunch when I started to cough a lot, and now it's hard to catch my breath.
Alright, we'll get that figured out for you. My patient is talking to me, so my airway is open, clear, and secure. I'll just quickly expose my patient's chest, making sure that there's nothing that compromises breathing. Do I find anything?
No injuries.
Alright, and then for circulation, I'm just going to quickly scan the body, making sure that there's no life-threatening bleeding. Do I see anything?
No injuries.
Alright, I'm going to go ahead and treat my patient for shock. They are going to be a high priority for transport, and we'll get them transported immediately. Alright, can you tell me what was going on when all this started?
I was eating my lunch from Subway.
Anything make this better or worse?
I finished my sandwich and I was eating my cookie and I started to feel weird.
Can you describe what that weird feeling was?
It's just getting harder and harder to breathe.
Is that that harder and harder to breathe? Is that moving anywhere? Is it radiating anywhere else in your body?
No, it's just hard to breathe.
Alright, on a scale of 1 to 10, 10 being the worst pain that you've ever experienced, can you rate that pain for me?
8 out of 10.
And then how long has this been going on for?
About 5 minutes.
Any allergies that I need to be aware of?
Peanuts.
Any meds that you're taking currently or should be taking?
EpiPen and insulin. But I haven't taken my Epi today.
Any past medical history?
I'm allergic to nuts and I'm diabetic.
What was the last thing that you ate or drank?
An entire sandwich and most of my cookie about 6 minutes ago.
Anything out of the ordinary going on leading up to all this?
I was fine until this happened.
Okay, so just to clarify, any cough, fever, chills, anything going on leading up to any of this?
No.
Okay, and then was there a chance that maybe that cookie or something that you ate had some peanuts in it?
Yes.
Okay. For my physical exam, I'm going to go ahead and assess my pulmonary system. So again, just exposing my patient's chest, making sure that there's nothing that will compromise any breathing. I'm also going to go ahead and also take lung sounds. I'm going to listen mid-clavicularly, mid-axillary, bilaterally, as well as on the back. I'm going to note the position that my patient is sitting in and their effort to breathe. What are my findings?
Wheezing in all quadrants and injuries.
I'm also going to assess the integumentary system. So looking at the skin, I'm looking for decap, BCLS, that's deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, swelling. I'm also going to be checking out if there's any hives, any facial or neck edema. I'm also going to look for a stinger across the body. If there's a stinger found, I'll go ahead and remove that immediately with a rigid object.
You find hives on the neck and facial and neck edema.
Alright, are you done with vital signs?
Yes, ma'am.
Can you read those off for me?
Blood glucose was taken, blood pressure was 130/82, pulse was 70 and strong, respirations were 14 and normal, eyes were pearl, skin was pink, warm, and dry, and SpO2 was checked.
Alright, can I go ahead and get my scenario vitals for blood pressure, pulse, respirations, eyes, skin, SpO2, and a blood glucose?
Blood glucose not indicated. Blood pressure is 96/66. Pulse is 108 and thready. Respiration 24 and labored. Eyes pearl. Skin flush, warm, diaphoretic. SpO2 is 92%.
Alright, I'm gonna go ahead, so due to that SpO2 and their increased effort to breathe, I'm gonna start them, have my partner start them on an NRB at 15 liters per minute. Alright, my field impression is that my patient is suffering from anaphylaxis and that we need to go ahead and intervene with that EpiPen. I'm going to go ahead and call medical control. Hey, medical control, I have a 23-year-old male experiencing some dyspnea. They are ANO times 4. They were just eating lunch, their sandwich, and a cookie when it got harder and harder to breathe. It started about 5 minutes before we called. 8 out of 10 pain. They do have a known allergy to nuts as well as they are diabetic. Have an EpiPen that they take as needed and insulin. My pulmonary exam findings was wheezing in all quadrants for the integumentary system. They had hives on the neck as well as facial and neck edema. My baseline set of vitals: blood pressure is 96/66, pulse is 108 and thready, respirators were 24 and labored, eyes were pearl, skin was flushed, warm, diaphoretic, SpO2 is at 92%, no blood glucose, did start them on an NRB at 15. Field impression was anaphylaxis. Want to go ahead and treat that with an EpiPen. Am I good to do that?
Permission granted.
Alright, hey sir, do you have that Epi for me?
Yes.
Alright, have you ever taken this before?
Once.
Alright, so you've taken it once before, so you kind of know how you're going to feel. You may get a little bit shaky. I'm just going to go ahead and expose your thigh really quick. So I'm going to go ahead and verify my drug dose, patient, route, and time on the EpiPen. I'm going to check the expiration date, make sure that we're good to go. I'm going to look for any discoloration. I am going to take the blue cap off, and on the lateral aspect of the outside of the thigh, I am going to administer the med until I hear a click. I'm going to hold this for 3 seconds. 1, 2, 3. I'm going to take it out, have my patient go ahead and rub that for 10 seconds, and I'll dispose this into the sharps container.
Medication administered.
Alright, it's now been 5 minutes since I administered that med. Can I go ahead and get my second set of vital signs?
Blood pressure is 116/82. Pulse is 128 and strong. Respiration 18 and deep. Eyes pearl. Skin pink, warm, and dry. SpO2 is 96%.
Alright, hey sir, how you feeling now?
It's a lot easier to breathe now, but I feel shaky and my heart is racing.
Alright, completely normal reaction due to that epi that we just gave you. Alright, so I'm going to go ahead and just reassess my patient's vitals, interventions, primary, secondary assessment, as well as chief complaint every 5 minutes en route, and I'm now good to give my verbal report.
Alright.
Alright, so I had a 23-year-old male patient experiencing some dyspnea. When I showed up on the scene, they were sitting in the tripod position, obviously looking like they were struggling to breathe. My patient was ANO ×4, said that they were just eating some lunch, eating their sandwich and their cookie from Subway when it started to get harder and harder to breathe. It was primarily in their chest, wasn't radiating anywhere. Pain was an 8 out of 10, started about 5 minutes before we had called. They do have a known allergy to nuts. They have an EpiPen that they take as needed, and then insulin. They are also a known diabetic. Again, just said that they were eating that sandwich and that cookie, said that something that they ate could have potentially had nuts in it and had an exposure. So on my physical exam findings for the pulmonary system, they did have wheezing noted in all quadrants. For the integumentary system, they did have hives on their neck as well as facial and neck edema. The baseline set of vitals: blood pressure was 96/66, pulse was 108 and thready, respirators were 24 and labored, eyes were pearl, skin was flushed, warm, diaphoretic, SpO2 was at 92%. Due to the increased work of breathing and the SpO2 level, my partner went ahead and started them at NRB at 15 liters per minute. My field impression was anaphylaxis. Went ahead, called medical control, and intervened with that EpiPen. 5 minutes after that EpiPen, blood pressure was 116/82. Pulse was 128 strong. Respirators were 18 and deep. Eyes were still pearl. Skin was now pink, warm, and dry. SpO2 had bumped up to 96%. Asked my patient how they were feeling. Said they were feeling a little bit shaky, but explained to them that that was completely normal. Went ahead and reassessed those vitals, interventions, primary, secondary assessment, as well as chief complaint every 5 minutes en route, and I'm done.